Hi, my name is Dr. Amadasu. I'm an ENT surgeon based in Abuja. And today I want to talk of something interesting. It's called a goiter. A goiter is a swelling of the thyroid gland, a little gland right in the middle of your neck or in the lower part of your neck. Now, this thing called the thyroid gland produces a hormone called thyroxine. And this hormone has effects on so many organs in the body. But I think the one most people are most aware of is your heart rate, your temperature, and all. But the thyroid gland is an essential gland in the body, and thyroxine is an essential hormone. So now, when there is a problem with the thyroid gland, sometimes it swells up and you have a lump in the neck, which we call a goiter. These lumps can be very small. You might not notice it. Somebody might just say, "Come, what's wrong with your neck?" Or they might be so large that they look like you're carrying a little ball just in front of your neck. Okay, so what causes the thyroid gland to swell up? Common causes are either lack of iodine, which is what the thyroid gland uses to make thyroxine, which is its hormone, and that is gives rise to a condition called hypothyroidism when the thyroid levels in the body are too low. Other things may cause hypothyroidism. There are conditions in which you're maybe taking a drug or eating some things like excessive cabbage, or the water in the area you drink causes the body not to absorb the iodine from your food, from your salt and everything. And then this could also lead to hypothyroidism. Okay. Then you have other situations where the thyroid gland is producing so much the thyroid hormone, and that's what we call hyperthyroidism. And it also causes an increase in the size of the thyroid gland. So these are benign causes of hyperthyroidism, benign causes of goiter. That's the gland grows big and it's not cancerous. Okay. Then you also have some tumors, that's growths within the thyroid gland. Okay. These tumors, some of them are benign, meaning they're not harmful. Others are malignant, meaning they're harmful. So they can also cause the thyroid gland to increase in size. Then we have things that we call cysts. You know, I've said it's a gland, so it's producing something. And if the mouth of the gland gets blocked, the thyroid hormone that is producing gets trapped inside and it swells up and it forms cysts within the thyroid gland. And this could cause the thyroid gland to enlarge. And we say the patient has a goiter too. So there are different things that cause a goiter. So if you notice any swelling in your neck, in the middle of your neck, first go to your doctor and make them look at it and determine if it is actually your thyroid or not your thyroid. And if it is your thyroid gland, you need to see a specialist that knows how to assess your thyroid gland. And ENT surgeons are one of such specialists, because we'll assess it to tell you what the initial problem is, and thereafter what managements we can offer you to look after your thyroid gland and your goiter. Have a good day.